Now we can move on to the skin cancer. So skin cancer is a disease and it can be occur in different forms. Okay, there are different types of skin cancer. We can go detail about the skin cancer. Skin cancer is an abnormal malignant overgrowth of certain types of skin cells in the epidermis and may metastasis or spread to other parts of the body. So, skin cancer simply means it is the abnormal growth of the certain types of skin cells. Etiology of skin cancer or the high risk for skin cancer that includes light skin color, hair color, eye color. So light skin means a fair skin, and the hair color also fair. Most of the time the skin cancer occurs in different countries, especially in US, okay, abroad. Then a family history of skin cancer, that is mainly due to genetic predisposition. Then personal history of skin cancer. If the patient have the personal history of skin cancer, there is again a chance for recurrence. Then certain types and large number of moles. So that is the moles, it may be a birthmark, and due to a frequent irritation or the unfavorable situation, this may be changed, okay, and may leads to cancer. Then freckles, which indicate sun sensitivity and sun damage. So freckles actually it's a cluster of pigment, and when it exposure to sunlight, sometimes it may vary its shape and where leads to a cancerous lesions. Then chronic exposure to the sun. Chronic exposure to the sun means there may be presence of ultraviolet rays in the sun. So if we are exposed to sun for a long time, there is a chance for skin cancer. Then history of sunburns in early in life. So that means if the patient has the history of sunburn, that leads to a skin changes. There will be skin color variations, and the moles may be changed to the cancerous lesion, or shape may be vary. Okay, so that history may leads to a skin cancer. We can see the types of skin cancer. There are 3 types of skin cancer. That is, first one basal cell carcinoma, second one squamous cell carcinoma, and last one melanoma. So melanoma is forms from melanocytes, skin cells that make the pigment. Basal cell carcinoma that forms basal cells. Okay, for small round cells in the base of the outer layer of the skin. Okay, that is the basal cell carcinoma. Especially the outer layer of the skin, increased chance for the basal cell carcinoma. Then squamous cell carcinoma forms in squamous cells. Especially again, squamous cells occurs in the surface of the skin, and it may occur in any parts of the body. Now we can move on to the squamous cell carcinoma in detail. Okay. Squamous cell carcinoma is an extremely common form of skin cancer which is usually non-cancerous, especially if caught it early.
In almost 97% of cases, the cancer can be excised and the patient will be fully recovered. In other instances, squamous cell carcinoma has the potential to metastasis, spreading to other portions of the body and creating serious health problems. So actually, squamous cell carcinoma is the carcinoma that occurs in the squamous cells. Okay, especially in the skin, outer layer of the skin. Actually, squamous cell carcinoma of the skin is a common form of skin cancer that develops in the squamous cells that make up the middle and outer layer of the skin. And squamous cell carcinoma, it's not life threatening and sometimes it can be aggressive and it is easily treatable if it found early. Okay, so that is the definition. Squamous cell carcinoma means it's a carcinoma that seen in the middle and outer layer of the skin, that is squamous cells. Next we can move on to the squamous cell carcinoma causes. Okay, the causes of squamous cell carcinoma. So here UV radiation, ultraviolet radiation that will damage the skin and predispose to the gene mutation that predispose to skin cancer. And the next one, it can be occur with keratosis patient or Bowen's disease patient. Actinic keratosis means it is the here the patient will have a dry scaly appearance of a lesion that the color may vary, red, brown, etc. And at last the color will be changed and the symmetry will be different. Okay, so that type of lesion is known as the actinic keratosis. So actinic keratosis, here there will be scaly appearance of the lesions and also it says dry nature. Okay, so this and it have different colors and sometimes it may occur as a patches. Okay, so this type of lesion is present, there is increased risk for squamous cell carcinoma. This is the picture of actinic keratosis. So here you can see a scaly appearance of a lesions that is small in size and the shape or the color is varying. Okay. Next one, genetic predisposition. Genetic predisposition in the family, if there is any history of cancer, the offsprings, there is a chance to get the disease. Next one, smoking, especially the squamous cell carcinoma of the lip. So if the patient have the habit of smoking, there is increased chance for cancer, squamous cell carcinomas, and especially in the lip. Then thermal burns. Thermal burns, the burns that change the nature of the skin, right? So at last there may be chance to get squamous cell carcinoma. Then chronic lung ulcers, the chronic irritations and non-healing ulcers may develop to cancer. Then immunosuppressions. Immunosuppressions, for example, azathioprine, cyclosporin drugs. If the patient underwent organ transplantation, so as a medicine, as a treatment of rejections, in order to prevent rejections, we will give the immunosuppressive drugs. So if we are taking continuously the immunosuppressive drugs, there is increased chance to get cancers because of the immunosuppression, the increased risk of cancer. Next one, pre-existing skin conditions, example lichen sclerosis and lichen planus can predispose to development of genital and oral squamous cell carcinoma. And the one important thing you have to remember is squamous cell carcinoma can be occur anywhere in the body. Okay, we have studied the cells, right? So squamous cells, it can be occur in our body, okay, in oral cavity or genital area or the lips or in the skin. Okay, squamous cell carcinoma can be occur anywhere in our body. Okay, so that we have to always remember. So in these conditions, lichen planus, we knew that lichen planus, the lichenification will be there, right? So usually due to the chronic irritation, the skin changes to lichenification. So that leads to squamous cell carcinoma. Okay. So when you have any lesions in your body, you have to observe, is there any change, is there any enlargement, or the symmetry is changing or shape is changing. All these things you have to check. Okay, so these are the causes of squamous cell carcinoma. Regarding the clinical features of squamous cell carcinoma, actually the squamous cell carcinoma will be a raised, crusty or scaly patch. Sometimes it will be ulcerated. So we have studied actinic keratosis or bounce patches can be seen in this squamous cell carcinoma. So the same appearance. It will be raised lesions and there may be chance for scaly patches or the crust formation in the lesion. And sometimes it may be ulcerated and most of the time this ulcer will be non-healing. Okay, so that's about the clinical features of squamous cell carcinoma. And based on the area this lesion is occurs, the characteristics may vary. So usually in the skin, this is the clinical features. Okay. Regarding the diagnostic measure, usually skin examination can be done. So in skin examination, we have to assess the lesion characteristics. Then biopsy. In the biopsy, you can do different forms of biopsy. Shave biopsy, you can do punch biopsy, incisional or excisional biopsy. All this biopsy can be helpful in order to identify the lesions. Then computer tomography, magnetic resonance imaging, all this depends on the area where the squamous cell carcinoma is located. Okay. As a treatment, we can do the surgical excision. Okay, that is the best method in order to relieve these lesions or cancer. Okay, in the early stage. Then radiation therapy may be considered as an alternative method. So here 45 to 50 Gay ray at 2.5 to 3.5 Gay ray per fraction. So you just study there is a we can give radiation therapy to the patient. So that's all regarding the treatment modality. And regarding the chemotherapy, usually we are giving the 5-fluorouracil for the squamous cell carcinoma. Okay, topical chemotherapeutic agent. As a topical chemotherapeutic agent, we can give 5-fluorouracil. So that's all regarding the management. We can move on to the next skin cancer, that is malignant melanoma. The name indicates that it affects on melanocytes. Melanoma, it affects on melanocytes. Melanocytes that give color to the skin, right? So we can see what is malignant melanoma. Melanoma is very serious form of skin cancer. Melanoma is the cancer of melanocytes. Melanocytes are located in the stratum basal and produce melanin. Okay, so the melanocytes, it's a pigment or it will give the color to the skin. So in this picture you can see a blackish appearance. So that will give, provided by the cells, that is melanocytes. So it's a cancer of this pigment or this melanocytes. That's why it is known as the malignant melanoma. Regarding the risk factors of melanoma, first one, family history. All the cancers will have the genetic predisposition. Okay, so the if it occurs in one family, it will may transfer to next generation. So that's why family history is important in case of any type of cancer. Then next one, dysplastic nevus, that is non-cancerous or benign or that is unusual looking moles, that is known as the dysplastic nevus. It's a nevus, it's a mole type appearance or patches. It's a pigmented one. Okay. Then previous melanoma. If the patient have the previous history of melanoma, the patient is in again risk. Then many nevus, that is more than 50 in one individuals. If there is presence of more than 50 nevus, that indicates the patient is in risk of malignant melanoma. Then freckling tendency. Freckling tendency means a lot of pigment cells that may occur in the body or the nearest area. There may be a cluster of pigment, that is known as the freckling tendency. Okay, then fair skin. Next causative factor is fair skin. So fair skin, this picture you can see the fair skin. Okay, usually more than Indians, US, British, they are in the high risk for malignant melanoma because of their skin color. Okay, because of their fair skin nature, they are in the risk of malignant melanoma. Next one is excessive use of tanning beds. So it's a machine. Okay, I will show you. This is the picture of tanning beds. Okay, so here the patient will be exposed to bright light. In order to darken their skin, the persons will be exposed to a bright light and they will use this machine. This picture you can see the bright light comes to the patient, the client body. So the excessive use of this machine, that may leads to malignant melanoma. Okay, here we are not using this type of machines. Okay, especially in US, other countries, there is a chance. Then genetic predisposition means in every individual there is a risk of cancer. Okay, so in the favorable situation is occurs, it will develops or gene mutation will develops and it may leads to cancerous lesions. So that's a genetic predisposition. Okay, every individuals will have the potential to develop a cancer. Then estrogen. Estrogen is a hormone, right? So this malignant melanoma will be highly proliferated in case of estrogen. So in the patient with the menopausal stage, the most of the persons will have malignant melanoma due to their estrogen effect. Okay, so the estrogen will stimulate the multiplication or proliferation of the melanocytes or the melanoma. So that is regarding the risk factor. Signs and symptoms of melanoma, it includes the melanoma, there will be appearance of a new mole. Okay, suddenly there will be appearance of a new mole and it develops slowly in or near an existing mole, and it will develop slowly, and the progress of this mole will be very slow in nature, and it will be very slowly it may become larger. And in case of men, it mainly seen in shoulder and hip and the head and neck area. In case of woman, usually it occurs in lower leg between the shoulders and the hips. And this may appear in underneath the fingernails and toenails, on the palms and soles. We can easily identify a malignant melanoma because it's asymmetrical in nature. Okay, asymmetry. There will not be a definite shape or symmetry in the mole. Okay, so if the asymmetry occurs, there is a high risk for malignant melanoma. This picture also you can see asymmetry of the lesions, and it is spreading slowly. Next one, A, B, C, D, E of melanoma. So in A asymmetry, one side is different from the other side. Okay, in the first picture you can see there is asymmetry. The one side is differ from the other side, so that is known as the asymmetry. Next one, B, that is borders is irregular, notched or blurred. So borders of malignant melanoma is irregular in shape and different notch is there, and it may blurred in appearance. Then color mixed. Okay, usually mole will have a unique color. Okay, instead of that, in malignant melanoma there will be mixing of colors. Then regarding the diameter, D is diameter larger than 6 millimeter. So increasing size of the moles, that indicates malignant melanoma. Then next one, E, that is mole evolves over time. So we can see the picture. Okay, firstly it is a small dot, then it becomes larger and larger and larger. Okay, so involvement of the mole is based on the time it will be spread, right? So a small dot becomes larger and larger. So that's why it is known as the mole evolves over time. So it is going to spread and the lesion will be involved. Underneath, involvement will be there and it is spread the nearest areas too. So that is the ABCD of melanoma. Regarding the stages of melanoma, in stage 0, melanoma confined to epidermal region. And stage 1, it is localized, only skin and very thin. Okay, the appearance will be in the appearance will be very thin. And stage 3, it is a localized disease and thicker than stage 1. So in stage 2, it will be spread from one area and the involvement will be beneath the skin. So more layers of the skin will be affected. In stage 3, it will be spread to lymph nodes. So it will be spread through lymph nodes and other areas. The skin will be occur again. In stage 4, spread to other organs. Malignant melanoma, it will spread to other organs. So the stages of melanoma. Stage 0, it is confined to that place itself. Stage 1, other layers, small localized disease and small small spread from the region. Then in stage 2, that is localized disease, but it is more than the stage 1. In stage 3, it will spread to lymph nodes, and stage 4, it will spread to organs. So in stage 4, the disease is more serious. Regarding the treatment of malignant melanoma, surgery is the best option for the malignant melanoma, excisional surgery, excision can be done, or the Mohs surgery, microscopic surgery can be done. Okay, then radiation is the other way of management. Then chemotherapy can be given with the cyclophosphamide. Then targeted treatment modalities can be given. And then immunotherapy with interferon alpha 2b or interleukins. Okay, so you can write the surgery, radiation therapy, chemotherapy, targeted therapy, immunotherapy. Okay. Actually, the targeted therapy that focus on target point. For example, BRAF inhibitor. BRAF, it's a proto-oncogene. Okay, so that will increase the growth of the cancerous cells. So if we inhibit the cells, the rapidly dividing cells will be stopped. Okay, if we are inhibiting the BRAF proto-oncogene, the rapid growth of the cells can be stopped. So that's why we are giving this targeted therapy or targeted treatment. The same way MEK, it's a protein that also it will stimulate the growth of the cancerous lesions. MEK, otherwise known as the mitogen activated protein kinase enzyme, or the protein that will inhibit the, or that will stimulate the growth of cancerous cells. So if we are inhibiting that cells, the growth of the cancer will be ceased, or the will be stopped. Okay, that's why we are giving targeted therapy. Immunotherapy that will increase the immunity of the body. So that's why the persons can attack with the cancerous cells and can improve their immunity. Usually the interferons. Okay, any one example you can study. That's about malignant melanoma.